If you take Eliquis, Jardiance, Xarelto, Januvia, Farxiga, and Entresto, or one of several other high-cost Medicare Part D drugs, do not assume the price you paid last year should still be the price you pay now. Medicare's first 10 negotiated drug prices took effect on January 1, 2026. But here is the boundary you need to understand immediately. The Medicare Maximum Fair Price is not one universal copay that every person pays at every pharmacy. Your actual amount can still depend on your Part D plan, your deductible, whether the plan charges a copayment or coinsurance, the quantity you receive, the pharmacy you use, whether you receive extra help, and where you are in the Part D benefit. Stay with me because I am going to do 3 things. I will identify all 10 selected drugs and their official negotiated prices. I will show you what to compare on your receipt, formulary, and explanation of benefits. And I will give you the exact question to ask if the amount at the pharmacy still does not make sense. Before we continue, subscribe if you want Medicare, Social Security, and senior money updates explained in plain English. A new rule can be real without producing the same result for every person, and a pharmacy receipt rarely explains the full calculation. First, what exactly changed? For the first time, Medicare negotiated prices directly with participating manufacturers for 10 high-expenditure drugs covered under Medicare Part D. The law calls each resulting amount a maximum fair price, often shortened to MFP. Participating manufacturers must make that negotiated price available for eligible Medicare Part D prescriptions. Medicare prescription drug plans must also include the selected drugs on their formularies, while an agreed negotiated price is in effect. That includes standalone Part D plans and Medicare Advantage plans that include Part D prescription drug coverage. But the maximum fair price is not a universal cash price, and it is not a promise that every person taking Eliquis will pay the same amount. Your plan still calculates what you owe under its benefit rules. 2 people can take the same drug and pay different amounts because one has met a deductible and the other has not. One may use a preferred pharmacy, while the other uses a standard network pharmacy. One may receive extra help. One may fill a 30-day prescription, while the other receives a 90-day supply. That difference does not automatically mean either claim is wrong. It means the claim has to be checked in context. Now let us go through the official list. You do not need to memorize 10 prices. Listen for the name of your medicine. Remember that each published amount is for a 30-day equivalent supply. And write down only the drug that applies to you. We will take the list in 3 groups instead of racing through 10 nearly identical announcements. The first group includes drugs commonly associated with diabetes, heart failure, or chronic kidney disease. Januvia has a negotiated price of $113 for a 30-day equivalent supply. The selected rapid-acting insulin group has a negotiated price of $19. That group includes Fiasp, Fiasp FlexTouch, Fiasp PenFill, NovoLog, NovoLog FlexPen, and NovoLog PenFill. Farxiga has a negotiated price of $178.50. Jardiance has a negotiated price of $197. Pause on that group for a moment. If you use Farxiga or Jardiance, do not compare your pharmacy payment directly with the published figure until you confirm the days supplied, the quantity, and whether the claim went through your Part D plan. The second group includes drugs commonly used for blood clots and heart failure. Xarelto has a negotiated price of $197 for a 30-day equivalent supply. Eliquis has a negotiated price of $231. Entresto has a negotiated price of $295. These are 3 of the names many viewers will recognize immediately. But again, $231 for Eliquis is not a statement that every person taking Eliquis must hand the pharmacist exactly $231. It is the negotiated maximum fair price for the defined 30-day equivalent supply. Your personal cost sharing may be lower, and it can vary under your plan. The third group includes higher-cost specialty drugs. Enbrel has a negotiated price of $2,000 a 30-day equivalent supply. Stelara has a negotiated price of $4,695. Imbruvica has a negotiated price of $9,319. Those numbers sound dramatically higher because these are different medicines used for different conditions with very different underlying prices. Do not compare the dollar amount for one selected drug with the dollar amount for another and assume the negotiation worked better or worse. The useful comparison is between the applicable negotiated price and the way your own claim was processed. That is the complete list of 10 selected drugs, counting the Fiasp and NovoLog products as one selected drug group under the program. You may also see headlines saying these negotiated prices were 38% to 79% below the drug's 2023 list prices. That comparison is real, but it is easy to misunderstand. A reduction from an old manufacturer list price is not the same thing as the percentage you personally save at the pharmacy. Part D plans already had rebates, negotiated arrangements, deductibles, tiers, copayments, and coinsurance before 2026. Result depends on how the maximum fair price interacts with your specific coverage. So if a headline says the negotiated price for Eliquis was 56% below its 2023 list price, do not assume your personal payment must fall by exactly 56%. The better question is this: how is the 2026 maximum fair price reflected in my cost for this prescription? Now let us turn to the first document you can check, the pharmacy receipt. Start with the basics. Confirm the exact drug name, strength, quantity, and number of days supplied. A 30-day fill and a 90-day fill cannot be compared as if they were the same transaction. A different strength, package, pen, tablet count, or product form can also change the calculation. For the Fiasp and NovoLog group, pay close attention to the exact product and delivery form. Several product names are included in that one selected group, but the quantity on your individual prescription still matters. Next, confirm whether the pharmacy actually processed the claim through your Medicare drug coverage. If you used a discount card, paid cash, or asked the pharmacy not to bill your plan, the transaction may not be treated as a normal Part D claim. It may also fail to count toward your Part D deductible and annual out-of-pocket spending in the same way. Ask the pharmacist one simple question: was this prescription processed through my Medicare Part D plan? Then check the pharmacy network. Some plans charge less at a preferred pharmacy than at a standard network pharmacy. Mail order may also be priced differently. The negotiated price program does not make every network pharmacy charge the same amount. Ask, is this a preferred pharmacy for my plan or a standard network pharmacy? Now check whether a deductible applied. A person who has not met the plan deductible may pay a different amount from someone taking the same medicine later in the year. Some plans also handle different drug tiers differently. A high payment early in the year does not by itself prove the maximum fair price was ignored. It may mean part of the deductible was included in that claim. Next, determine whether your plan uses a fixed copayment or coinsurance for that drug. A copayment is generally a set dollar amount. Coinsurance is generally a percentage of the plan's covered drug cost. Those two designs can produce very different looking receipts. This is one reason two neighbors taking Eliquis can pay different amounts without either receipt automatically being incorrect. After the receipt, check your Part D explanation of benefits, commonly called the EOB. Your drug plan sends an EOB for months in which you use your coverage. It summarizes your prescription claims and can show the drug you filled, what the plan paid, what you paid, what other parties paid, your benefit stage, and how much counts toward your out-of-pocket total. Do not throw this document away just because it is not a bill. Place the EOB next to the pharmacy receipt and compare 5 details: the fill date, drug name, quantity, pharmacy, and amount you paid. Then check how the claim affected your deductible and out-of-pocket total. The EOB may not print the words maximum fair price in the place you expect. That does not make the document useless. It gives you the exact claim information you need when you call the plan. If the receipt and EOB do not match, or if the claim appears to have been reversed and processed again, call the member services number printed on your plan card. Do not use a phone number from a text message, a social media comment, or an advertisement claiming to fix Medicare drug costs. The third place to check is the plan formulary. The selected drugs with negotiated prices must be included on the formularies of standalone Part D plans and Medicare Advantage plans with drug coverage. But formulary inclusion does not mean every plan handles every detail identically. Look for the exact drug and strength. Check the tier. Check whether prior authorization, step therapy, or a quantity limit applies. Check whether a 90-day supply is allowed. Check which pharmacies are preferred. A drug can be covered and still have a coverage requirement that affects how the prescription is filled. Do not ignore a prior authorization request because you heard the drug has a negotiated price. The negotiated price and the plan's coverage process are related parts of the benefit, but they are not the same question. Now let us make the phone call easier. Instead of trying to read 9 questions in a row, begin with 3 core questions. Core question number 1 is, was this claim processed through my Medicare Part D benefit, and what price did the plan use? This establishes whether you are looking at a true Part D claim and gives the representative a specific calculation to explain. Core question number 2 is, did a deductible, copayment, or coinsurance determine what I paid? This identifies the part of the benefit design that affected your cost. Core question number 3 is, did the pharmacy network, quantity, or days supplied change the amount? This helps explain why your receipt may not resemble a published 30-day figure. Only after those 3 answers should you move to the follow-up questions. Ask what tier the drug is on. Ask whether prior authorization, step therapy, or a quantity limit affected the claim. Ask whether the claim should be reviewed or reprocessed if the information appears wrong. And return to the most important question, how is the 2026 Maximum Fair Price reflected in my cost for this prescription? Ask for a reference number for the call. Write down the date, the representative's name if available, and the answer you received. If the explanation affects your money and still does not make sense, ask for it in writing. You can also contact Medicare or your state health insurance assistance program, known as SHIP, for free, personalized Medicare counseling. Here is a common question. Does this apply to Medicare Advantage? It applies when your Medicare Advantage plan includes Part D prescription drug coverage. These plans are often called MAPD plans. If your Medicare Advantage plan does not include drug coverage, or if your prescription is processed through employer, union, Veterans Affairs, or another type of coverage, contact the organization that actually handles the claim. Another common question is, my drug is on the list, so why is my copay still high? Possible reasons include a deductible, coinsurance, a larger quantity, a different product form, a non-preferred pharmacy, or a claim that needs review. A high amount is a reason to ask for an explanation. It is not proof by itself that the plan violated the rule. There is also a separate Part D protection in 2026 that limits annual out-of-pocket spending for covered Part D drugs. That protection can affect what you pay over the course of the year, but it is not the same as the maximum fair price for these 10 selected drugs. One policy establishes negotiated prices for selected medicines. The other limits annual out-of-pocket spending under Part D. They can both help, but they answer different questions. Most important, do not stop taking Eliquis, Jardiance, Xarelto, Entresto, insulin, or any other prescribed medicine because a receipt surprises you. Do not change the dose, split tablets, delay a refill, or switch medicines without speaking with the prescribing clinician or pharmacist. This is a coverage and cost check. It is not medical advice. To finish, remember 4 things instead of trying to memorize the entire video. First, the receipt. Confirm the drug, strength, quantity, days supplied, and whether Part D was billed. Second, the EOB. Compare the claim and see how it affected your deductible and out-of-pocket total. Third, the formulary. Check the tier, pharmacy network, and any coverage requirements. Fourth, the phone call. Ask how the 2026 Maximum Fair Price was reflected in your cost, and keep a record of the answer. Receipt, EOB, phone call. That is the simplest way to check whether the new negotiated price is reaching your prescription correctly without assuming that everyone should have the same copay. If you are checking one of these medicines, you can comment with the drug name and whether your cost went up, went down, or stayed about the same. Do not post your Medicare number, prescription number, date of birth, address, or private medical information. Subscribe and share this with someone taking Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, or another drug on the list. A receipt tells you what you paid. The right question helps you understand why.